नमस्कार. प्रुडंट मिडियाच्या हॅलो दोतर कार्यावळीन तुमकां सगळ्यांक मना काळजासान येवकार. तुमकां येवकार दितना आयचे जे अतिथी आसात, एक्सपर्ट गेस्ट आसात, ते आसा डॉक्टर विक्टर कोएलो, जे कन्सल्टंट युरोलॉजिस्ट म्हणजे मुतखड्याच्या दुयेंसांचे तज्ञ दोतोर जावन आसात विक्टर हॉस्पिटलाचे. आनी आयचो विशय आसा तो म्हणजे मुतखड्याचे दुयेंस आनी ताचेर जे ट्रिटमेंट म्हणजे उपचार पद्दती हाचे विस्कटान आमी चर्चा करतले. आनी ह्या चर्चेचो बरोचसो फायदो तुमकां सगळ्यांक जातलो असो म्हाका विश्वास आसा. तेन्ना मुद्दाम वेळ काडून आमचे बरोबर आशिल्ले डॉक्टर विक्टर, वेलकम, नमस्कार. आता कितें आसा ते बरोच काळ ते बेसिकली गोंयकार, पण खूब काळ तांचो गोंया भायर गेल्ल्या कारणान ते इंग्लीश हिंदी चड फ्लुएंटली उलयतात. सो तांकां मातशें एम्बेरेसींग जावचें न्हय म्हणून हांव मातशें थोडेशें इंग्लिशीनच विचारता. तुमकां कळटा आसतलें आनी जें कळपाक जाय तें हांव तुमकां विस्कटान सांगतलो. तर डॉक्टर, फर्स्ट ऑफ ऑल वेलकम यू टू द स्टुडियो.
Thank you, sir.
And today we are going to talk something about renal stones or kidney stones and its management. So basically when we talk about the stones, the basic question first, fundamental question, what do you mean by renal stone or kidney stone?
Renal stones or kidney stones are actually concretions of certain chemicals that get accumulated in the kidney. Now the reason why they are getting accumulated in the kidney is basic supersaturation of certain minerals in the kidney or in the urine. If I were to give a simple example, like if there is some amount of salt that is present in the water and more salt we are adding to the water, at one point of time the water will get supersaturated. And that salt, when it is supersaturated, comes out in the form of renal stones. So the stones are actually primarily formed in the kidney, and based on how the urine carries them forward, it can be in the kidney, it can be in the kidney pipe, that is the ureter, or in the bladder.
Achha. And how they are formed? Basically, since you have mentioned about what you mean by super saturation, so in the same process is over here also or something else?
It is the same process. It is chemically the same process where urine gets supersaturated with certain minerals, mainly calcium, oxalate, and phosphate. Achha. And when these chemicals are supersaturated in the urine, that comes out as stone formation.
Achha. So apart from this, there will be some risk factors also, because we have seen that in some families or some individuals, they are prone for this renal stone, despite of removing again and again they get. So there are some risk factors. So what are these risk factors?
One most important dictum to remember is, once you form renal stones, there is a 50% chance that you will form renal stones once again. Now when it comes to risk factors, there are a number of risk factors. The risk factors could be diet related. If any diet which is rich in oxalates, which is rich in red meat diet, which is rich in salt intake, these are the patients who are prone to develop kidney stones. Second is familial hereditary also. Achha. There are some patients in the family we see when we practice in the clinic or in the OPD, the father has, the son has, and it runs in the family. There is certain, I have been practicing in Victor Hospital for maybe 6 months right now, and there is one particular belt in South Goa, Konkani district. For some reason, we are not sure why, but many patients there present to us with kidney stones, and if left untreated, they develop chronic kidney disease and kidney failure. So there are certain geographic areas, there are certain hereditary factors, there are certain dietary factors that predispose the patient to develop kidney stones.
Achha. So at this point of time, it is very important that your hospital is recognized under DDSSY. आणि ताचो हो फायदो आसा की समजा कोणाकूय प्रायवेट हॉस्पिटलां म्हणजे तांच्या हॉस्पिटल वचपाचें आसा जाल्यार DDSSYच्या स्किमीच्या अंडर हे कवर्ड आसा. आणि त्या खातीर म्हाका दिसता गोंय सरकारचे जे प्रयत्न आसा की हेल्थ म्हणजे भलायकी ही फक्त गव्हर्मेंट सेटअपा पुरते मर्यादीत दवरनासतना सगळ्या बाकीच्या हॉस्पिटलांकूय तांच्यानी एनगेज करून घेतल्या, सो दॅट लोकांक चडांत चड फायदो मेळचो. आणि एक खूब कौतुकास्पद गोष्ट अशी आसा की आज फक्त भारत देशान न्हय तर म्हाका दिसता अख्ख्या जगानूच अशें म्हणत अशें एकच हें गोंय अशें राज्य आसा जेन्ना ही स्कीम सगळ्या हॉस्पिटलांनी चडशा हॉस्पिटलांनी अप्लिकेबल आसा, जाचो फायदो गोंयकार खंयच्या खिणाक वचून करून घेवंक शकता. आनी ही खूब बरी गजाल आसा. म्हणजे ताची गोंयची भलायकी यंत्रणा म्हणा, गोंयचे मानाधिक भलायकी मंत्री म्हणा, गोंयचे मानाधिक मुखेलमंत्री म्हणा, हांच्या सगळ्यांच्या प्रयत्नांनी ही बेनिफीट सगळ्या लोकां मेरेन पावता, ही खरीच कौतुकास्पद गजाल आसा. Doctor, when we talk about this renal stone, another form, what are different types of stones they are formed? Because just now you mentioned about these oxalates and other things.
Yes. Main type or majority of the type of renal stones are calcium based stones. When I say calcium based stones, it can be calcium oxalate, can be calcium phosphate, or can be phosphate based stones. Some types of stones are secondary to infections. That is what we are calling them as struoid stones. The stones with multiple antlers, or commonly called as even Staghorn stones. So these are the main types of stones that actually present.
Just now you mentioned about oxalate and other types of calcium oxalates and all this type of stone. I'm just asking a very tricky question, maybe academic twist. What are the diet, like you tell in common language, like what we have cauliflower, which is in oxalate. It is something like that. You just tell in simple language so that people can refrain from taking this type of diet in their this thing.
The main idea regarding prevention of stones when it comes to diet is the diet should be a well-balanced diet. We do not recommend that you do not take seafood completely. That is very, very difficult for any Goenkar to tell that don't take nusta or don't take any fish.
Absolutely.
That is not possible.
Correct.
But you take a well-balanced diet. Sodium intake or salt intake should be limited. When I say salt intake should be limited to less than around 4 to maximum 5 grams per day. When you take red meat, many people are taking red meat. Red meat intake should be less than 1.2 to 2 grams per day. So what is recommended is a well-balanced diet, but not complete restriction of any one particular thing or not. Previously, it was wrong concept to think that certain vegetable like tomato, which has little small seeds in it. Initially, we also were thought that don't take that diet. But actually, there is no scientific proof to avoid those diets in order to prevent renal stones. So more or less, the final point is well-balanced diet with limited intake of salt.
In fact, this is what I wanted from you. कारण आजपर्यंत आम्ही कितें आयकत आयल्या की टोमॅटोच्यो बियो खावपाक जायना, भायले खाव येता किंवा आनी हेच प्रकारचो तत्सम जो लोकांचे विचार किंवा कितें म्हणटा मिथ्स जे आसा म्हणजे गैरसमज आसा ते पयस करपाचो हो एक प्रयत्न आसा. आणि त्यांना डॉक्टरान सांगला ते एक गोष्ट खूप महत्वाची आसा की आमी वेल बॅलन्स डायट घेऊ. म्हणजे जशें आमी केन्ना हॉटेलांत वता एक थाली घेता, तातूंत एक भाजी आसता, एक सॅलड आसता, एक सोलकडी आसता, एक हुमण आसता, शीत आसता, चपाती आसता. अशा पद्दतीचो वेल बॅलन्स डायट प्रत्येक मनशान घेवपाचो सदांच. रादर दॅन जस्ट टिकींग म्हाका हें आवडटा म्हणजे हांव फक्त नुस्तेंच खातलो, सुंगटाच खातलो, चिकनच खातलो अशें करनासतना अशा पद्दतीचो डायट जर घेत जाल्यार तुमचें आरोग्य बरें उरतलें आणि रिनल स्टोन म्हणजे किडनीचे स्टोन म्हणजे फातर जावचे ना अशें ते सांगूंक सोदतात, विच इज व्हेरी इम्पॉर्टंट पॉयंट. Doctor, one more thing I just want to ask you. When this type of stones are formed in the body, how the patient presents with? What are the signs and symptoms?
The most commonly, the patient will present with pain and where in the flanks, in the back region. Besides that, the patient may also have some amount of passage of blood in the urine. Or little cola-colored urine, high-colored urine we are saying. If the stone is large enough to cause obstruction to flow of urine, patient can have symptoms like fever. Patient can have vomiting. And very, very rarely, but even sometimes patient can have a stone inside but not have any symptom at all. And only when incidentally they go to do health checkup or they go to do incidentally to do ultrasonography, there the stone is picked up. So the symptoms can be very, very varied, but most common symptom is pain and little amount of blood in the urine.
सो डॉक्टरान सांगला की एखाद्या वेळा जर तुमच्या लघवेंद्र रगत दिसला किंवा मातशे हाय कलर्ड युरिन म्हणजे जशें च्याच्या रंगाचे म्हणटा कडू च्या जी असता म्हणजे दूध घालनाशिल्ली त्या पद्दतीचे जर तुमचे युरिन म्हणजे लघवे आसा जाल्यार तुमी डॉक्टराकडे वचून तपास करप खूप गरजेचें आसा. केन्ना केन्ना फातर आसता पण ते दुखनात आणि अशें मीन इनफॅक्ट इट इज क्वायट कॉमन इन स्टॅगहॉर्न ऑल्सो. अँड हे स्टॅगहॉर्न कॅल्को जे थोड्या वेळा तांणी सांगला थोड्या वेळा पयलीं सांगलें ते केन्ना केन्ना इतके व्हडले जातात पण ते त्रास करनात. आणि एखाद्या वेळी कोइन्सिडेंटली तुम्ही जेन्ना डॉक्टराकडे वता कित्याक खातीर तुमचो सोनोग्राफी करता तेन्ना तो दिसता. आणि समटायम्स आय वॉन्ट लिटल मोर एक्सप्लेनेशन अबाउट दिस स्टॅगहॉर्न कॅल्को. यू नो वाय बिकॉज समटायम्स दे कॉज द रिनल डॅमेज सो मच दॅट किडनी इज टू बी दिस थिंग. सो आय वॉन्ट लिटल एक्सप्लेनेशन ऑन
दिस. The Staghorn calculus actually starts from the renal pelvis in the center and it will keep on growing out to cover all the calyces, upper calyx, middle calyx, lower calyx. This particular stone normally does not cause that much amount of pain. It is secondary to recurrent urinary tract infections, and that is why patient will not come to us saying that they have pain because there is no pain. But incidentally detected, they will find that the stone has become so large. Sometimes it causes kidney damage, and then sometimes patients can come even with renal failure.
ह्या गजालींतल्यान एक म्हत्वाचो मुद्दो हो आसा की हो फातर किडनी आशिल्ल्या कारणान दुखना. ऑफन डिस्पायट ऑफ नोईंग की पेशंटाक कळ्ळां की आपल्या किडनीन खंय तरी फातर आसा तो इग्नोर करता आणि त्या खातीर ट्रिटमेंट घेवंक सोदना बिकॉज इट डजंट पेन विच इज व्हेरी बॅड. हातूंतलो एक मुद्दो म्हत्वाचो होय आसा की हो स्टोन जेन्ना वाडत वता तेन्ना तो फूल किडनी डॅमेज करूं शकता आणि ती किडनी काडचीय पडूं शकता. ह्या खातीर द रेड सिग्नल ऑर द रेड फ्लॅग आय वूड से दॅट यू वन्स इट इज डिटेक्टेड यू कन्सल्ट अ युरोलॉजिस्ट, टेक हिज ओपिनियन, वॉट एवर ही सेज यू फॉलो. कारण often we have habit of it doesn't pain. असं दुखाना whatever, and I always feel that whatever is not paining is more dangerous.
Yes, sir.
Paining is best.
Yes.
People go, even if he will go back, steal, borrow somewhere, he will do, but he will go for a health whatever remedy has been suggested. दुसरी गजाल अशी आसा की हे जेन्ना स्टोन जाता तेन्ना दर फावटी ते दुखताच अशें ना, पण जाला जाल्यार तुमी स्वताचे वन मोर थिंग आय एम नॉट सेइंग हू इज रायट, हू इज रॉंग, बट ऑफन वी हॅव people in general say that there is no, they feel that there is no medicine in allopathy, so they go for all Ayurvedic herbs and all that homeopathy. I'm not saying who is right or wrong. I'm not saying Ayurvedic medicines are not good, but there are quacks also, or there are unqualified doctors, so-called as in villages. We have some traditional, they take this medicine, take that medicine. There is no proper dosage, and in fact, sometimes they land up in more problems and complications. I want little explanation on this.
It is not that renal stones cannot be managed medically. It depends on the size of the stone. For that, I will say stones up to 4, 5, maybe even 6 mm. If the stone is less than 6 mm, definitely there is a role of medical management. So I'm not saying that every stone has to be operated, but if the stone grows more than 6 mm or more than 7 mm, then it is difficult for the spontaneous passage of that stone. And that is where operative surgery or endoscopic urological interventions is necessary.
बरोबर. म्हणजे जेन्ना तुमकां फातर आसा अशें दिसून आयला किंवा डॉक्टरान सांगला, तेन्ना दर फावटी असो मनान निश्कर्श दवरू नाका की ॲलोपॅथी कडेन हाजो काय उपायच ना. डॉक्टरान सांगला एक 4-5 मिलीमीटरचे स्टोन वखदांच्या माध्यमांतल्यान काय ऑपरेशन करनासतना बुडूंक शकता, ताका योग्य ते ट्रिटमेंट गरजेचें आसा. तेन्ना बेश्टेच हांगा थंय, म्हणजे हांव म्हणटा केन्ना अशें की गांवांतले वखदां, म्हणजे हांव परत गांवांतले वखदां वायट अशें म्हणना, पण ताजो प्रॉपर अभ्यास केल्लो किंवा जे लोकांनी सायंटिफिकली प्रूव्ड आसा ते तुमी घेवचे असो म्हजो ओपिनियन आसा. Doctor, one more thing. Once now, since you have mentioned about all these things, how you come to conclusion? What are your modalities of investigation and management or detecting these stones?
So the most important investigation to detect renal stones would be a non-contrast CT scan. Now, CT scan gives us a lot of information. Like people will say, why not sonography? You can do sonography, but sonography does not give that much information as CT scan will give us. So CT scan tells us the exact size of stone. CT scan will tell us the hardness of the stone. CT scan will tell us the complete anatomy of the kidney. So we can plan further treatment based on what we see on the CT scan. And also the modalities of treatment, whether you want to give shock wave or whatever treatment, based on the hardness of the stone, which we get through CT scan information, we can plan. Okay. That is why if somebody has one investigation that has to be done, it will be non-contrast CT scan of the abdomen and pelvis.
अच्छा. सो हो एक महत्वाचो मुद्दो आसा, कारण केन्ना केन्ना आमी ते करपाक पावना किंवा खूब कडेन अशें करनात. बट आय फील वन्स यू गो टू एक्सपर्ट, ही विल डेफिनेटली सजेस्ट दीस, एंड वन्स इट इज सजेस्टेड यू हॅव टू प्लीज फॉलो. म्हाका दिसता हें करून घेवप गरजेचें आसा डॉक्टरांच्या सल्ल्यानुसार. स्वताहून करपाची गरज ना, डॉक्टर सांगता तेन्ना करून घेवप. दुसरें म्हणजे डॉक्टर, वन्स यू आर डिटेक्टेड और वन्स यू आर डायग्नोज, नाव वी आर कमिंग टू द मॉडलिटी ऑफ ट्रीटमेंट. You have mentioned some of the things, but little more explanation.
So the modalities of treatment is broadly based on the size of the stone and the location of the stone. Now for stones in the kidney, like I was saying before also, if it is less than 5 mm, we can give trial of medical management, where medical management helps in spontaneous passage of the stone. Stones more than 6-7 mm, it is very difficult for it to pass down spontaneously. So for that group of patients, or anywhere up to even 2 centimeters, which is 20 mm, we have a new modality of treatment recently come now called RIRS, which is retrograde intrarenal surgery. Now what is RIRS? RIRS is a modality, sir, where we are going through the urinary opening into the ureter, from the ureter into the kidney, going with very, very fine flexible scopes and laser machine. And with that laser, we are dusting the stone into very, very small dust. And the patient comes one day in the morning, patient will get discharged 24 hours, no cuts, no long operative stay, and patient is back to work after 3 or 4 days. So this is one new treatment modality available for management of renal stones up to 2 centimeters. Some people are even trying to extend the use of RRS for more than 2 centimeters, but according to European guidelines, up to 2 centimeters, we can safely and comfortably perform this operation in the kidney.
Acha. But okay, then that is one more thing, that minimum invasive surgery.
Yes, sir.
So when you opt for this and when you opt for RIRS?
So RIRS is a type of minimally invasive surgery.
Acha, okay.
No cut, no scar, nothing for the patient. Through natural orifice we are going and breaking the stone. If the stone is more than 2 centimeters, 3 centimeters, like Staghorn stone, that time this mode of treatment is not recommended.
Acha.
Then we are doing PCNL procedure. PCNL procedure, we are doing a puncture directly into the kidney, and through lithotripters or instruments used to crush the stones, we are working through that.
Acha.
That requires a cut over the skin and a direct access to the kidney.
So you can say it is a minimal invasive
Minimal
surgery.
invasive surgery.
So basically, when you decide about the mode of treatment, it depends on the location of the stone.
Yes.
It depends on its hardness, where it is located, how it is situated, and what is the patient's acceptability for that.
Yes, sir.
Okay, nice. Now, one more thing. As we have discussed earlier, there is a medical line of treatment or medical management also possible.
Yes, sir.
So what is that?
So the medical line of treatment, specifically, there are stones, they originate in the kidney, and some of them will slip down into the pipe, that is the ureter, which connects the urinary bladder and the kidney. So for these group of stones, if they are up to 5 or even 6 mm, they can be passed out through what we call medical expulsion therapy or MET. What does MET involve? MET involves adequate hydration,
Acha.
lot of water intake, and also 2 groups of drugs. One group of drug which relaxes the muscles of the ureter, that is of the pipe of the kidney, and causes an expulsion of stones more spontaneously. This medical expulsion, we are normally giving a trial of up to 14 days, and after 14 days, if it passes, that is a good thing for the patient, no need for any operation. But if it does not pass after 14 days, very less chance. Like it will be only 60 to 70% chance it will pass. Not passing after that, it may not pass down.
Achha. So since we have discussed about all these things, what is no, one more thing I want to ask you, because since we have got little ample time and it's a right forum. See, you mentioned before some time about a balanced diet. I
Yes,
totally agree. But now taking into account Goan population, taste of Goan people, what you would recommend? And I have got one more tricky question for you that I will ask you after that.
Sir, like what I said before.
And in this, one more thing I want you to highlight, how much water should be consumed?
Yes. So the water consumption and hydration is the most important thing in preventing renal stone formation. That is the bottom line. Now, when I say how much of water or how much of hydration that is required, enough to produce at least 2 to 2.5 liters of urine daily. So how much ever water you want to take, maybe about 2 to 3 liters, but you should pass at least 2 to 2.5 liters of water daily. That is adequate hydration. After water intake, we then come to salt intake. Salt intake is very important because the common salt that we are using, iodized salt, that also causes stone formation.
Achha.
But how we have to take that? Maximum 4 to 5 grams per day. Now, when I'm saying salt intake, we have to understand that salt is present not only in food we eat, but any preservative food, any farsan food, any chips, everything salt is present. So that intake has to be reduced very much significantly. Also, there are some types of stones like oxalate stones, which actually come from consumption of excess of red meat or beet or excess of chocolates. That should be limited. So when we are taking about animal protein, because many of here the animal protein is consumed less than 1.2 to 1.5 grams per day. That is the recommended amount. But broadly, if I have to classify, sir, one well-balanced diet. That is the most important thing to.
Yeah. So again, I'm a little hampering around the same because this is what we can practice.
Yes, sir.
So हे दोतोरान सांगला हे खूप गरजेचे आसा की आमचो वेल बॅलन्स डायट आसा खूप गरजेचे तातूंत सॉल्ट म्हणजे मीठ आमी मातशें कमीच वापरपाचें गरजे पुरतेच वापरपाचें आतां ताणें 4 to 5 grams म्हटलां बट इट मे व्हेरी डिफिकल्ट फॉर अस टू वे अँड यूज इट सो आणि म्हजो एक प्रोफेसर सदांच म्हणटालो इफ युअर वायफ इज कुकिंग वेल देन इट इज लायकली दॅट यू विल गेट अ हार्ट अटॅक सो तशें हांव म्हणून अशें सांगना की तुमच्या बायलांनी बरें रांदचें न्हय अशें हांव म्हणना पण इम्पॉर्टंट म्हणजे तुमी चड ताचेर म्हणजे बॅलन्स डायट इज मोर इम्पॉर्टंट एकच गजालाक आमकां कितें आसा गोंयकारांक नुस्तें तळिल्लें जाय आसता सुंगटां जाय आसता इसवण जाय आसता मागीर ते शिणाण्यो जाय आसता खुबे जाय आसता सी ऑल दीस टायप ऑफ थिंग्स आर मोर प्रोन टू गिव रिनल स्टोन हें सारकें लक्षांत दवरपाचें डॉक्टर्स अगेन आय एम टॉकिंग अबाउट सेम थिंग often we say that cucumber or this type of fruits are good for health. So what is your take on this? What you would recommend?
Yes. Yeah. Fresh green leafy vegetables and fruits recommended definitely. But no proven role to say that vegetables with small seed like cucumber, like brinjal, like strawberry will cause stone formation.
Achha.
It was in the past people are saying that it
Correct.
causes,
Yeah.
but no real scientific proof to say that that causes stones.
अच्छा. So one more thing what I would like to know, doctor, कि once now you have already managed this patient surgically or whatever modality of management you have, now what is your follow-up advice for this type of patients?
Very important to understand that once a patient forms a renal stone, you have to explain to him that 50% of the chance he will form stones again in his life. So what you have to understand, once the stone has been cleared, you have to do a whole body checkup to know what is the value of calcium, what is the value of phosphorus, what is the value of oxalate in his diet. And if there is any abnormality, that has to be corrected first. So what we recommend is 24-hour urine examination
Achha.
after stone treatment has been taken care of, to know if there's any mineral abnormality. So can we give any medicines to correct that? Otherwise, we are only doing a mechanical work of removing the stone, but underlying problem we are not treating. Like there are some patients like hyperparathyroidism. It is a problem in the parathyroid. The calcium level will be very high. They will form stones. We will treat the stones. But the underlying problem where the parathyroid problem is causing the stones, we are not treating. So very important, after the patient has been treated, do a 24-hour urine examination, do complete blood work, a workup, see if there is any abnormalities and whether you can correct it or not.
Achha. So this is also important. म्हाका दिसता हो खूब महत्वाचो मुद्दो आशिल्लो. Doctor, as I said earlier, I have got one tricky question for you.
Yes.
I don't say we believe or we don't believe. People in Goa at large believe that if you consume beer regularly or SOS, there are most probability that since there is a good flow of urine, your stone will pass off or they will not form. What is your take on this?
I will not say stones will not form, but stones will pass ground quite easily. Now, what is the scientific basis of that is, beer also is like a diuretic. It helps in flushing out stones. But that doesn't mean if you don't consume enough amount of water, the stone will not pass.
Correct. So, म्हाका दिसता खूप महत्वाचो मुद्दो. तुम्ही सगळेजण फाल्याच्यान उदक पिनासतना बियर पिवपाक लागशात म्हणून सांगता. Beer can help, but most important is water. ते उदक असता म्हणून जाता. It is not that beer component. Maybe it is slightly as he said की मातशें मुतूंक चड जाता म्हणून ते पडपाक इझी जावं शकता. पण स्टोन जावचे ना अशें न्हय आनी जे शिरकल्ले आसा ते भायर सरतले अशेंय न्हय. दिस इज व्हेरी इम्पॉर्टंट लायन टू बी अंडरलायन. ओके, तो आतां हें कन्क्लूड करच्या पयलीं म्हाका दिसता एक म्हत्वाचो असो एक मुद्दो आसता की समटायम्स दीस पेशंट कम विदाउट एनी सायन्स एंड सिम्पटम. Which are the people who come without sign and symptom and how you manage them?
Without sign and symptoms, actually, it is more dangerous for that particular patient because they are not aware. There are no warning signs for them to come. They are doing an ultrasonography or a CT scan for some other reason, and they instantly find to have stones. There are many patients with chronic kidney disease, with renal failure, who come in end-stage renal disease with very, very high creatinine values. And these group of patients, it is very important to understand and help them understand that yes, there is a large stone. The symptoms, though they are not having symptoms, the stone is damaging the kidney and causing further kidney failure. And therefore, it is very essential for them to have treatment for those stones.
Okay, as we conclude, I have got very specific and pinpoint question to be answered in the brief. Often, people have a belief, as I talked about beer also, often people feel that early in the morning, if you take around, 1 liter or how much water they can consume maximum, there will be less chances of stone formation. But this bulk quantity of water, is it helpful or it has no role?
Not helpful, sir. You can consume, like I said, up to 2 or 3 liters of water daily over a fixed spread period of time, not at one go.
ओके, थँक्यू. म्हाका दिसता आयच्या कार्यावळीच्या दरम्यान बरीचशी मोलादीक म्हायती तुमकां सगळ्या मेरेन पावल्या आसतली, ती समजली आसतली. डॉक्टरान सांगलां त्यामुळे सकाळी उठून खूप उदक पिवपाची गरज ना, पण एट अ स्प्रेड म्हणजे तुम्ही एक 2-3 वरांनी युनिफॉर्म क्वॉन्टिटी पिवपाची. दिसाक 3 ते 4 लिटर उदक गोंयच्या मनशान पिवपाकच जाय. गरमेच्या दिसांनी चड गरज आसूं शकता. त्या प्रमाणे आपल्या डायटाचेर लक्ष दवरात आणि जर पेनफूल स्टोन ना, म्हणजे स्टोन आसा पण दुखना जाल्यार इग्नोर करू नाकात, दोतोरा कडेन वचात. आनी ही मोलाची म्हायती तुमचे कडेन पावयतना डॉक्टर विक्टर मुद्दाम आमच्या स्टुडियोन आयले, वेळ काडून. एका खातीर तांकां काळजांच्यान देव बरें करूं. तशेंच तुमी सगळे कार्यावळ पळयतात, तुमकांय काळजांच्यान देव बरें करूं. नमस्कार.
Thank you, sir.